Okay, to start the first response kit, we'll start with the vitals pocket. This is the top pocket up here, and we've got in here stethoscope, blood pressure cuff, blood glucose measuring kit, thermometer, pediatric blood pressure cuff, trauma shears and pupil torch. And here we've got miscellaneous stuff, but paramedics will often carry drugs in here. On the two side pockets, we'll start with the hypoglycemia pocket, which contains glucagon, a syringe, and various types of glucose, including oral and intravenous. In this top pocket here, we have an emesis bag, some numbing spray, PPE, and C-spine lanyards. In this pocket here, this is the trauma pocket. In here we've got saline for wound irrigation, an assortment of different bandages and gauzes, and 2 tourniquet in case one doesn't work and we need the other one. So going into the main section of the kit, we have got, starting off at the top, all of the tropical drugs that we'll carry on us, including tramadol, paracetamol, and we've also got methoxyflurane. In this pocket, this is the airway management pocket, so we've got an assortment of different sizes of MPAs and OPAs. Also got a laryngoscope, some lube, and some tongs for getting things out of the throat that people are choking on. Moving down, we've got the nebulizer and miscellaneous oxygen tubing, including nasal prongs and nebulizer mask and nebulized drugs. For example, adrenaline and ibuprofen, I think that's how you say it. Also got in the main compartment a towel, sharp container, slippery sand. We've got some saline IV here, a C-spine collar. We've got 2 splints, pediatric bag valve mask, adult bag valve mask. We've got our LMA, IV roll, and we've got to mention is that there's a biohazard bag that is stored with the OPA and MPAs and all the airway gear. Now, in our pediatric bag valve mask, we have our PEEP mask, an assortment of different sizes, mask for children's faces, chamber, you know, all the normal stuff that's in a bag valve mask. With the adult bag valve mask, we have got our oxygen tubing, our bag valve mask chamber, adult facial masks, filter, and a PEEP valve. We've also got a high concentration oxygen mask stored in here. Now, moving on to our IV roll, we've just got everything we need for intravenous drugs, which we don't have to worry about at our level, and we've also got the LMA, which we also don't need to know about, we just need to know where it is. Okay, today we're looking at the suction unit. So the suction unit is comprised of rubber tubing, a rigid or soft catheter, we've got reservoir, we can take the reservoir out by pushing this down and clipping it out. We've got a filter, switch, battery, and water for unblocking the rubber tubing, and before we use it, we got to test it. So we press the test button, turn it to full power, and open the tubing. So the indications for using suction would be a patient with an altered consciousness, for removing fluids from their mouth or throat, or removing fluids from anywhere in their body. Now that test is completed, and we can see that it's a successful test. Turn that off. Now before we suction a patient, we'll make sure that the patient is lateral, so that anything comes out with gravity, and that we only suction for 10 seconds or less in a rotational movement on the way outwards from their mouth. We do not suction on the way in. You cannot suction with a hard catheter. It must be a flexible catheter for children and moving vehicles because of soft tissue injury and soft pellets of small children's mouths. So when we suction, you turn the suction on, you do not have your finger blocking the hole, and only as far as you can see in a rotational movement, you block the hole and you suction out for no more than 10 seconds. You want to be careful that you do not stimulate the vagal nerve, causing bradycardia or cause any soft tissue injury. Okay, so this is the bag valve mask. Now it's comprised of a reservoir bag which will be filled with 100% oxygen. Only L1 is broken. If it was working it would be filled up. We're connecting it to oxygen bottle at 10 to 15 litres per minute. This is the main BVM reservoir chamber. We've got the expiratory valve, filter, a PEEP valve which is just placed onto the filter if we want to add more pressure and force more air into the lungs, which increases alveolar surface area and gets more oxygen into the blood. And we've got an adult facial mask here. Now, some complications for using a bag valve mask can be facial hair or obesity. But when we use it, we want to make sure that the oxygen is turned on and that the BVM works. So we can do that by checking to make sure the reservoir bag is full and that we can put pressure on the chamber and no air comes out. So once we've got that, we want to make sure that the pointy bit goes towards the nose of the patient, and we can use a CE grip. When ventilating, we want to make sure that we get chest rise. Now when we are ventilating, we only squeeze the bag 1/3. This is the rule of threes. And we can also get a offsider to come in here and use the ventilate for me while I do a double-handed head tilt chin lift with thrust. And make sure we get good ventilations. Now when we are ventilating, we want to make sure that we do the ventilations once every 6 seconds, or if we're doing CPR, we want to make sure that compressions are 30 compressions to 2 respirations. And when we are breathing for the patient, we can have the patient in something called a sniffing position, which is this, with a towel behind the back of their head, keeping their head down and the airway open, or we can have the patient in a recovery position, with their head back, and ventilate from there. Now, we'll also demonstrate using the nasal prongs. So just take out the OPA and MPA, and this is the nasal prong tubing. We use this for prolonged oxygen administration, and it is non-invasive. Put it on the oxygen bottle at 2 to 4 litres per minute. And if we put it on the patient, we want to ask for consent. So, excuse me patient, can I give you oxygen tubing? Yes. What we will do is we will place it over the patient's head, in the nose, tuck the oxygen tubing over their ears. Okay, so this is an OPA. An OPA is used for maintaining the airways of patients who have a lower GCS. Before you put it in, you want to measure from the corner of the mouth to the angle of the mandible. You put it in, scoop facing towards the nose, halfway in, rotate it 180 degrees, and insert the rest of the way. You do this for patients with low GCS or patients who do not tolerate an MPA, for example, traumatic brain injury. For an MPA, you want to make sure you get the right size. You go from the nose to the earlobe. Before you put it in, you want to lubricate it to make sure it slides in easily, and you'll rotate it and put it in perpendicular to the patient. Now, you would not put an MPA into a patient if they have a traumatic brain injury, and this is very good if they do not tolerate an OPA. Okay, so we're here with the LifePack 15, which is a defibrillator and a monitor. Starting off, we'll just go over what's contained in the kit. Starting on the right hand side, we've got defib pads, which are connected up to the monitor ready to go in case of an emergency. We've also got cardiac drugs like GTN spray and aspirin housed in here, as well as a spare razor and the 12 lead ECG cable. On the other side, we've got the 3 lead, which is housed inside this container, as well as spare paper for the printer. Around the back is where the SpO2 probe is stored, which plugs in just here. We've also got the end-tidal CO2, which plugs in just up here by twisting it in until it's tight. This needs to calibrate before it can be used, so once it's plugged in, you can just leave it ready for an ICP. We've also got the test load, which is needed for testing the shock, and sometimes we'll find spare batteries back here. Now, in the back compartment, this is where we have the blood pressure cuff, which is housed. But also sometimes Well, we'll have to look at spare batteries as part of testing it, and to do that you can tell here by pressing a button how much charge is left in each battery, and then you seal that back up. It's ready to go. Now to start off with, you must first turn on the defibrillator. You do that by pressing the on button, and it will come on and it will be in AED mode. To get out of that, you press leave, which takes you to the screen. Now from the screen we can then run a user test. So we'll click options, select user test, and then click. While that's going on, we can set up the defibrillator test to make sure that it shocks. So what we do is we will unplug the defibrillator pads and plug it into the test load. Just like this. And now our test is now completed, and we can rip it off and see that the user test has passed. Now from here we will go into manual mode to deliver a shock. To do that, you just click energy select and select going into manual mode. We don't need to do a big shock for the test, so we can select 50 joules, which is good enough. We'll select that and then click charge to let that charge. Now you can dump a charge at any point by just clicking this button, and to deliver a shock you let it charge up, and once it's come all the way to the end, click shock and it will say shock delivered. Okay, once we're done with that, you can unclick it, and always put your ECG, your defibrillator pads back on when you're done, so it's ready to be used. And you should always wrap it up nice and tidy. To save time, I'm just going to stuff it in here. So to do a blood pressure, what we will do is we will click the NIBP, which is non-invasive blood pressure. I'll now demonstrate how to set up a 3-lead. So to do that, you're going to get your 3-lead out of the kit and make sure it's plugged in. And then there's 4 leads here, and it will have right arm, left leg and right leg. And when you go to your patient, you will make sure that you click them onto the correct position. So right leg, left leg, left arm, and right arm. And that's how you attach ECG dots. So from there, because the dummy doesn't have any pulse, I'll show you how to put it into demo mode, and I'll show you around some of the screens. Oh, sorry, I'll just turn that off. Push. To go into demo mode, you want to unplug the defibrillator and also the 12 lead end-tidal CO2 and SpO2. And then you hold down the event and home button at the same time and hold the on button, and that will put it into demo mode. So from here, what you can do is you can select and maneuver around the screen. So you can do things like change the size and make things bigger so you can see it. Then you can have a sound come on for heart rate, and you can adjust the noise like that. You can turn it all the way down. To print out, you click the print button here to start printing and click print to stop printing. And you want to test before you start using the monitor, you want to make sure that there's enough paper inside. So what you can do is you can pull this, check to make sure there's enough paper, close it back in. To set a blood pressure that goes at intervals, what you do is you select the blood pressure and then select an interval that you want it to change at. So I'm just going to set it on 5 minutes and leave it at that. And that's all the basics of the LifePak 15.